Hello, it's Rochelle again with Land O'Lakes Physical Therapy, and just to segue into our desk size exercises from our ergonomics video. And typically I don't like to do exercise at the desk, so if you paid attention to the last video, I said I want you up every 30 minutes and I want you doing about 30 seconds of activity. So all of the exercises I can show you sitting down. Preferably I would want you to stand up and pick one or two of these as your 30-second activity, but nonetheless we will go through all of them, and just to give you some ideas of how to get the blood flowing to those muscles and those joints that sit stagnant for hours on end. Okay, so at your desk you can perform everything that I'm going to show you, or you can stand up. It's either way is fine. And the one thing I want to really address and stress is that I usually see people with neck pain, and the biggest reason they have neck pain, and here is your key takeaway point, is they're locked or they can't move well through their mid back or upper back. Okay, so I'm going to show you some exercises to get some blood flow, some mobility through that neck, through that mid back, and then hopefully that will help break up some of that repetitive activity that you're doing at your desk. Okay, so the very first one that I would like you to focus on is I call it smell something bad. So I try to give these names that you'll remember. So if somebody put something in front of my face and it smelled bad, I would, ew, it stinks. So then I kind of push my head back and then it comes forward. And then I smell something bad and then I bring it forward. This is called chin retraction. And what you're doing is you're opening up your spine in the back of the neck, and you're finding the muscles in the front of the throat, and then you're letting your head relax. So I call it smell something bad. So you're gonna smell something bad and pull your face away from your hand. Now, to do this exercise, you do not have to intentionally put your hand up there, but if it helps you think about not tucking this way or tucking up, it's straight back. This is another exercise that I teach people so that they are, if they're driving home and they're commuting and they're maybe at a stop sign, they can actually smell something bad, moving their head back and working on that chin retraction, okay? One of my favorite exercises, I got no money. So pretend I'm pulling or emptying out my pockets, my palms are up, and then I'm going to say I got no money. I got no money, okay? So you can practice this for your accountants. I got no money. All right, so what you're doing is you're gently squeezing or pulling those shoulder blades together. Again, that shoulder blade that sits on your rib cage, you're just getting some blood flowing to those muscles. I tell people if you can do 5 or so every hour, every 2 hours, it's a tremendously easy activity that gets that mid back some blood flow and some movement, okay? Next one I call put your hands up. Okay, so put your hands up like you're a robber and you just got caught, okay? So this is getting some shoulder, what we call external rotation, and you're putting your hands up, you're squeezing those shoulder blades together, and then you're bringing them down. So you can put your hands up, squeeze those shoulder blades together. You might even feel this in your neck a little bit. Sometimes I have people pinch those shoulder blades and I just have them do some of that neck range of motion, coming back to the middle, okay? So putting it all together, you can put your hands up like a robber, do your little chin tuck, and then you're gonna turn, you're gonna come back to the middle. So that one I call put your hands up. All right, the diamond stretch. All right, so putting your hands behind your head. Now you're not gonna pull your neck forward. You're just gonna make this kind of diamond shaped pattern. And then I want you to inhale and side bend, opening up the ribs, and then I want you to exhale back to the middle. Then inhale, and then exhale. Inhale, and exhale. So you're moving laterally so you can open up the ribs, and you're breathing in the air, expanding the ribs. And if you are watching and you are doing practicing some of your diaphragmatic breathing, let your breath start at the belly and exhale back to the middle, okay? And you just did that robber exercise, so you should have this motion. If you don't, or you have pain, or you're limited, then either don't do it, or you should probably follow up with myself, a physical therapist, or somebody that can help you with that. All right, bow and arrow. This is probably my second favorite exercise. So I generally do it at the end of the day on the floor. You could do it standing against a wall, but I call it bow and arrow because we want to try to move the bones of the spine in this motion, okay? So opening up wide, like you're stretching your pec, you're going to reach with your other hand, and then you're going to slide the fingertips across the arm, across the chest, and unwind, letting your arm unwind and your head follow, okay? Then you're going to come back, and then you're going to slide bow and arrow, turning the head and opening up. Come back to the beginning, slide, letting your eye gaze follow that hand, and back to the middle. So you can do that on the other side, and you may notice a difference from side to side, and that's totally normal, but maybe one side's a little stickier than the other, but you're gonna slide that hand across the chest, unwinding the spine, letting your eye gaze follow that hand, curl it back up, reach with that muscle in that arm, and then you're gonna pull across your body and let your eye gaze follow. This also helps floss your nerves that are coming out of your neck and the front of your chest. And so now you've exercised your nerves as well. Very nice. Okay, moving on to a seated upper track stretch. So I think I'm going to switch chairs. It's probably a little bit easier to show on this chair. So what I'm going to do is I'm going to grab underneath my chair. I might have, if your arms are really long like mine, you might have to grab the leg. Depends on where you're going to have be able to hook your hand. But then you're just going to gently drop your left ear down to your left shoulder, and you're just going to feel that stretch. There's no need for an overpressure. You can just hold this here, let gravity stretch you. You can take your eye gaze up towards the ceiling, a little bit different position, the front of the muscles, and then coming back, and then you change sides. So tip the ear towards the same side shoulder, holding this and breathing, and exhale. The reason why I have you hang onto your chair is so that your shoulder isn't coming up, okay? If any of you know me, I'm not a huge stretcher, but I like dynamic movement and I like breath. Again, you can turn and look your eye gaze up towards the ceiling, stretch a little bit different part of that neck, and then come back to the middle. Some very simple exercises. You've probably seen these over and over again, right? These are the good oldies but goodies, but just doing some good old-fashioned shoulder shrugs, both directions, can help get some blood flow to those joints. Okay, and remember I said, ideally I'd like you to stand and do these exercises, but if you're stuck in a meeting or you can't stand up after an hour, then I'm just trying to show you some activities that you can do at your desk. Another exercise would be a seated figure four. So I bring my ankle over to my opposite knee, and if I look down, it looks like the number 4. And then I could just gently press that knee down and feel that in my hip. I could even take it a little further, taking up the slack and bending forward, taking a breath here, and coming back up. And then again, changing sides, figure 4, ankle goes to opposite knee, You can give a little gentle overpressure at that knee, pushing it down towards the floor, and then take up the slack and bend forward, articulating the spine, and take a deep breath in. If you've been practicing your breathing from some of the other videos, I want you to think like you're starting your breath down in your belly and you're inhaling through your nose, letting your belly expand. And exhale. Maybe you get to sink a little deeper on that exhale. Very nice. Another thing I want to show you is some mid-back mobility. So this is just a ball. If you have a towel roll up here that you can use, that works as well. A high office chair is probably not going to work as well, but you know what? It actually might be just something that you can do for mobility in that mid back. So even if you have an office chair that's higher and you have a towel roll going across your back, you can still do what I call the butterfly mobilization. So you're here like a butterfly, and then you're gonna exhale, opening up your wings and arching your mid back over that ball, that towel roll. Inhale and exhale. Obviously you can't do this one standing, but you could do something very similar to this if you were lying down, putting a towel roll across your back. And you're just, again, getting those shoulder blades, some blood flow, those shoulders, and you're arching that back. Let's do one more as you exhale. Very nice. So that helps to unstick that mid back that so many of us struggle with. I'm going to change out my chair so that you can imagine this is an office chair. Another thing that is nice to do is just being able to stretch the upper back, or like a simulated child's pose. So you could slide your arms forward. You're going to push your hips back into the chair. Don't let your shoulders shrug, hold them down. And then you're just gonna breathe in your nose, allowing your belly to expand into your thighs, and exhale out. So it goes like this. Inhale through the nose and exhale. Inhale and exhale. So every time I inhale, my belly expands or pushes into my thighs, and I'm filling up that mid-back area with some air, and I'm sinking my shoulder blades in between those shoulder blades, and then I'm going to pull myself back up. And you can even push yourself and make this more of a dynamic exercise than a shoulder stretch. So this is what we call shoulder flexion. So this will get your arms and shoulders moving, getting some blood flow, and then coming back up to a seated posture. Now again, I told you that everything could be done standing as well. But those are just some examples of some activities that you can perform in between your 30-minute breaks. So when you stand up after 30 minutes, pick a few of these activities and just keep your body moving. That is the key. Motion is lotion, and we want you to be up and moving. And these are called Deskercise exercises for a reason, because hopefully you can learn how to move your body just like you don't have to think about breathing, okay? So please join us for our dowel exercises in our next video, and I hope you do well with all of these. If you have any questions at all, please do not hesitate to reach out to one of us at the LOL Well Clinic, or myself, Rochelle Ani, the Land O'Lakes physical therapist. Thank you so much.